Hello, this is Meta Kumar, and you're watching Medicircle. Do you know that the healthcare and the medical device sectors have grown significantly in the last decade? At present, many medical device manufacturers, both domestic and international, are chasing this massive under-penetration of medical devices in India as a significant growth opportunity. Like in India, India is already among the top 20 markets for medical devices worldwide. Yes, it's true that we are actually importing a lot of devices from other countries. We are dependent, but there are still segments which are opening up, and we are realizing that there is a lot of scope there. This market is expected to increase at a CAGR of 37% to reach 50 billion USDs in 2025. That is from rupees 75,611 crores in 2020. So the medical device sector in India comprises of large multinationals and also small and mid-sized companies. I think here you can see a diverse companies having different kinds of innovations, some very, very huge, some very big, some at a very nascent initial phases, but yes, they have also their own share of pie, and they're also catering to so many healthcare providers out there. I think that's the beauty of this segment. So hi, today we have Chandrasekhar K with us. He's the founder and CEO of Forus Health, and Forus Health is a medical technology company with an audacious goal to eradicate preventable and avoidable blindness. That's a global healthcare challenge today. So hi and welcome to Medicircle, Chandrasekhar.
Hello, everybody, and thank you for having me on the show, and so happy to be part of this.
So we are also very privileged to have founders who are actually solving such a big problem in India, where there are so many children and youth going blind due to such blindnesses, which can be definitely avoided by proper screening and timely treatment. So to begin with, as the founder of Forus Health, tell us more about your venture.
Yeah. So first thing, I don't come from a medical device background or from ophthalmology background. So I worked for 20 years in the semiconductor industry. Our primary inspiration came from Aravind Eye Hospital, Madurai. And we basically found that a lot of Indians go blind. India is the largest blind population in the world. And if you really look at the reasons, we have less number of doctors, and we are prone more to cataract. Now diabetes is on the increase. So we felt that given that this country of about 1.3, 1.4 billion people has only 20,000 ophthalmologists, we need to bridge this gap using technology. Right. And so we started this company. It's for us. It's for us, or you pronounce it for us, but it is actually for us. It's for our community. And we wanted to solve the problems which we see in India using our own technology. So that was the reason why we started Forus Health. And the goal aligned with somebody like Arvind or LV Prasad or Shankar Nethralaya is to eradicate avoidable blindness. So we decided that we will do that using technology, while we'll complement some of the best hospitals for their clinical practice using our technology. So that's the reason why we started Forus Health.
And what are the prime USPs of Forus healthcare system? Because again, you are working into something called preventative health, because people are going blind due to a lot of reasons, glaucoma, sometimes cataract, sometimes there are less diagnosis that is being done. So intervention is not happening in that scale. So there are a lot of blindnesses that can be actually eradicated, that can be treated. So what exactly is the USP of Forus?
Yeah, so I think the first thing, and I think this is the primary difference about us compared to anybody else in terms of eye care, is that we did not want to become a medical devices company. We wanted to eradicate avoidable blindness. Medical device was a consequence, right? So there is this goal or mission imbibed in everything what we do. So we didn't start with medical and stop there. We created many things because the goal was to solve a problem, right? So when we looked at the situation, the first gap what we found was medical devices were very expensive. They all were only in very high-end hospitals. They all required dilation, and it also required a specialist operator, right? Now, when you want to actually do screening for millions of people, you need to build technology which will not only be in hospitals but can also be, let's say, in primary care, maybe even in a village, in a school. So if you have to make technology which will have access to a common man so easily, you have to build it on your own. So that is the reason why we started to build medical devices first. So we focused on three areas. We focus on adult retinal imaging. Today, we have probably the most comprehensive adult retinal range of cameras. And then we built a product for neonatal. And I'm very happy to say that in the neonatal space, we are probably the leader in the world. So we have the most advanced product in the neonatal imaging. It is actually a very most difficult product to make, but we were able to do 100% in India. So we didn't actually look at other designs. All of our designs have been built from scratch by us using our intellectual property. And the third area we decided to focus was refraction. So refraction has often been an area where disruption has not happened for a long time, but still 2 billion people in this world still require a pair of spectacles and don't have them. So if we have to reach to them, we'll have to actually kind of innovate in that space. So we have the most comprehensive retinal imaging systems. We have the most advanced neonatal imaging system, and we have the most innovative refraction system. So that's how we started. Today, as we speak, we have about 3,100 odd installations in about 50 countries, and we have touched lives of about 9 million people so far globally. But when we started to build devices, we also found that when we have to get into a larger impact, we need to get into public health. And to go to public health, you just can't be a devices company. You need to actually develop an end-to-end platform so that you can deploy and actually see the impact. So we built a platform. I think we run one of the the largest teleophthalmology project for the government of Andhra Pradesh with Apollo Hospital front-ending that. And we built that entire platform where today more than 2 million people have been screened across 150 community centers, 1.6 million spectacles have been delivered, about 600,000 retinal examinations have happened, and about 100,000 people have been identified with problems. So we built that. Then we looked at how do I complement this using artificial intelligence? So we have a lot of data ethically stored by us. So we started building a lot of artificial intelligence into the platform to do grading of images, disease identification, and also sometimes improving productivity. So a combination of all that. And the last piece is we now started feeling that, can I do the last mile? Can I do the screening ourselves? So we have started to engage more on home and corporate screening post-COVID, and we have been able to last year touch about 134,000 people in India using our technology. So it's using our hardware, our software, and we reach the last mile providing to people, and then connect them to the treatment ecosystem, which is the hospital. So that's pretty much what we do. And we feel that it is very different because it is continuously connected to our goal. Of course, when we sell a product, we compare that with a competitor as a product to product. But I think when I talk about the holistic solution, I think we are pretty unique globally. And we continue to build these smaller components which are required to fulfill our mission. So that's very much our differentiator, is what I see.
And these screening devices that you're talking about, that can screen people as easily at their convenience, like at their home. So they are being done by optometrists. And were you able to train such a workforce?
Yeah, no, I think the imaging is not even does not even require an optometrist. It requires, so because the imaging is so the basic question is, why should imaging and diagnosis happen at one place, right? So we do imaging anywhere. No, we built artificial intelligence to tell whether the image what somebody has taken is gradable enough or not, and then it is interpretation is done by an ophthalmologist. So we're not kind of compromising on that, but we teach somebody who's like a 12th grade person also. We can teach him how to take an image. A technician can be taught how to take an image. He doesn't have to be an optometrist, because we don't want them to interpret data. The interpretation should happen by the ophthalmologist. We only teach them how to take a good picture and kind of send it to them. They grade and send it. So we're not compromising anything on the clinical side, right? Because that's very important. Because see, one important thing in this whole thing is our goal is to eradicate avoidable blindness. That will happen not just because you screen somebody. If you screen somebody and tell him that he or she has got a problem, unless they go to a doctor and get their problem solved, you're still not solving the problem, right? So what do we do in order to make these people uh, curious, so we to go to a doctor and get themselves treated? So we're trying to do all the things which is behaviorally pushing these individuals to go to treatment so that they don't go blind. So that is the overall objective.
That's something very, very, very interesting approach, especially because mostly the problems which the startups are or ventures like this are trying to solve, they actually are bringing the patients to that information kind of a level, awareness thing that yes, this is the thing which you may be we should be aware of, and this can be a problem. But changing into their behaviors and change is definitely very, very, very complicated. It's definitely difficult to let people understand that this may happen and showing the consequences. And if it is definitely an avoidable thing, people should be, the way they should be uh, behaved in the way that they should be going to doctors, seeking for a medical approach sometimes. Mostly not, most of the time, these diagnoses are not done on a regular basis. The screening, that's why I asked, this reading is so much important that this should be the base of all the further treatments, which is definitely going to solve all such avoidable blindnesses. Chandrasekhar, your startup has also received funds from ACEL Partners, IDG Ventures, also Asian Healthcare Fund. So, how much funds you have raised so far, and how has the funds been utilized so far?
So we have raised money, about $18.3 million, about three series. Axel and IDG funded us in Series A, Axel, IDG, and Asian Health Fund in Series B, and then Team Fund, and then Axel and Asian Health Fund in Series C. IDG's shares were later acquired by New Quest Ventures. So we have so far raised about $18.3 million. Primarily, we have used this to build products and also do some market penetration. So as we have got completely made Atmanirbhar in India, and we have regulatory approvals for the US, for Europe, for Australia, New Zealand, Saudi Arabia, Middle East. So many countries. We're selling to 50 countries. So primarily, the money has been used for creating products, getting regulatory approvals, building these platforms. So the platform today, as we speak, will be a big differentiator for us going forward. So the platform has got all the compliance, the HIPAA compliance, the cybersecurity compliance. So makes it, we want to ensure that the entire data privacy, data security part is also taken care. So we built that. So most of the fund has been used primarily for that, and obviously for market penetration in some of the outside countries.
And I think in this journey of yours, you were also able to generate a lot of employment, especially when the screenings can be done by technicians, even 12 hours, and they can be trained. So again, there could be like one thing that you are also making livelihoods easy for all those people who can be trained and further used for this.
Absolutely. Yeah, I think ultimately, if you really look at it, we need to create rural entrepreneurs who can take up ownership of some of the activities which they can actually do in a village for a community, right? Which will ensure that that community is kind of taken care from a health perspective, and they should also be able to earn their livelihood there. So the more we create and we combine, so it's not just diabetes is there, blood is there, a few others can be added. So if a rural entrepreneur manages all that, and one thing which you have to make it very clear is he only does collection or imaging, doesn't do any interpretation, so that in the anxiety to do good, we shouldn't do even an iota of bad, which is also very critical. And then that will ensure that access is there for most of these people who are in rural locations, and it will also create livelihood, right, for most of the people. And when you have pandemics like COVID happening, you can use most of these people to communicate what to do. So because they are kind of seen as semi healthcare people, and they probably can understand these things better, so you can communicate with them. And obviously I think that will help countries like India to ensure that we do regular screening. And the other important part which everybody ignores, especially in eye care, what we see is what we call as disease management, right? So cataract is something where you can have an intervention and get it solved. But if you look at glaucoma or macular degeneration or diabetic retinopathy, they are chronic diseases. So if you are identified with this problem at 40 years and you're going to live till 80, somebody has to maintain your disease for 40 years. So I think it's very important that, and by general behavior, people will comply for 2, 3, 4 years, and then they'll stop going to hospitals. So that's the time somebody has to ensure that we provide access to them, take the image, send it to the hospital, ensure that they're not getting into a vision threatening problem. So I think there's a very big role, a combination of technology with access can play both in primary care, preventive care, and disease management.
Definitely. And what were your revenues in FY 2022, and what you are planning to close at this end of year FY 2023?
Yeah, we are a venture funded company, so we generally don't disclose revenue, but all I can tell you is for the last couple of years, we have been a bit positive. We grew about close to 40% from the COVID year to last year. And this year, our plans are roughly to grow about 70 to 80% over the March revenues. So, we wanted to really build a company from scratch in India, which will be a reasonable order of magnitude in the medical devices space, not only in creating products, but also offering services. And not just in India, but in the US, Europe, and Africa and Latin America.
That's good to know. And so as you are there in most of the cities in India, and you're also serving to 50 plus countries, as you just mentioned. So what are the expansion plans, especially for the future?
No, I think, we basically look at how do we increase the reach, right? How do I manage to screen more people? How do I ensure people with refractive errors get spectacles, pair of spectacles? How do we manage disease of people? So it's going to be a combination of building more devices for some of these gaps, what we see, building much more comprehensive platform, customized platform, and then connecting doctor and patients to ensure that they comply if they have chronic diseases, and take this managed care not only in India and US, but in other countries as well. So our next 3 to 4 years, how do I multiply this 9 million impact to, let's say, 100 million impact? So that's the goal, what we wanted to think about.
So that was great to know, Chandrasekhar, especially the good work which you are trying to do in this very much needed segment, where we can avoid such kind of blindnesses, especially for our children and also for the youth of India. Just on the ending note, would like to know any experience of yours or any learning which you would like to share with all the fellow entrepreneurs who are watching this video today.
Yeah, I'm not super successful to give advices. But in my limited experience, all I can say is two things. One, uh, the more deeper you understand the problem, I think you will find out solutions. So I think the primary objective is not technology or implementation. I think the primary objective is to how deep you can understand the problem. What is the problem? Why that problem is there? Why behaviorally it is not changing? What should we do to do that? So if you get that portion correct, it will help you to build a product which could be just a product or a solution which could be a hardware software combination, and then it'll also help you to implement that much better. So I think deeper understanding of the problem. So if you, let's say if you want to do something in tuberculosis, um, I think understanding that completely thoroughly, what is the problem, why it is coming, what is the prevalence, which area it is more, what is the solution, and how many doctors are there, what is the current solution, why people are not, what are the number of people dying. So all these questions. And then I think it's not like just picking up statistics, but actually going deeper, understanding, talking to doctors, talking to patients, talking to their relatives, talking to nurses, all of these people who are part of the chain will give you a very good understanding of the problem. The moment you understand that, I think India has got lots of bright minds who will find definitely a better solution. The only thing is, if you don't go into depth, there are chances that you may, in the anxiety of developing, you can develop a product and then you go to the market, you'll find that there is a gap. So I think if we do that thoroughly, I think India can actually be a very big player in the devices space, especially because our doctors are so good, right? And the number of cases what we get in India, we will never get anywhere in the world. So if we can make a product in India and make it work in India, it can be taken to any part of the world. So I think that is very important. The second thing, which is very important from a very hygiene point of view, is we need to think that we are building a global product. So all the hygiene factors. So I know how painful it is to spend money on packaging, on manuals, on many things, the look and feel. These are things which we ignore, right? And even though we may have a technically a good product, aesthetically it may not be a great product. I think lot of emphasis should be given to that. So right from day one, I think we should think that I'm going to build a world, a product which will go global, right? If we have that mindset, we may not take it for the first 5, 6, 7 years. Even we didn't take our product for first 5 years because you don't have money, you don't have so many things. But I think that mindset is very important, because then you will build a world-class product. And if you make a world-class product, it will definitely be sold all over the world. So I think those are the two small, uh, I would say, I won't say advice, but whatever I learned.
Yes, your learnings. And thank you so much, Chandrasekhar, for joining us today on our healthcare startup series. I think the government of India is also doing its bit, like as they have, like they are also emphasizing on the strengthening of this medical device sector, because they have like on this R&D, or they have 100% FDI for medical devices just to boost this market. And I also visited this medical fair in India. I saw so many manufacturers coming with excellent products, and like some even having disposable curtains and things like that. And a lot of places I found that made in India and made for the world. So that is the concept which our Indian entrepreneurs are finally finding into, and giving India a boost in the medical device sector, which is much, much, much needed. Thank you once again, Chandrasekhar, for joining us today and sharing your experiences and journey with us.
Thank you so much for having me.